My name is Nancy Corser, and currently I work with my husband Ron Corser in our own business, and I'm responsible for the health care planning side of our business, in particular helping people with their insurance needs. I am a specialist in the area of long-term care planning and insurance, and I chose that area of specialty because a number of years ago, when I turned 50, I decided it was time for a career change. And I always had an interest in insurance and had parents and a mother who was getting older that I knew at some point in time would need more help in terms of their insurance needs and in particular long-term care. I really enjoy helping people with their insurance needs, also help in the area of Medicare planning and with people that are turning 65. Taking a complicated subject and helping them understand what it means to buy a supplemental insurance and Part D prescription drug coverage and so on. We are living longer than ever before, and as a result of that, we are going to have longer term health care needs in terms of insurance that may go well into our 80s or 90s, and it's important that when we're in our 50s or 60s that we begin thinking about, well, what's really needed here. When I lose my coverage from my employer or my individual plan, really having an idea of, okay, what is Medicare and how does that work, and what are the gaps within Medicare? They don't have dental, they don't have vision coverage, they don't have long-term care coverage, and then helping people with those gaps of coverage. So long-term health insurance is generally when you require some type of custodial assistance for a period of more than 100 days. Currently, Medicare will cover up to the first 99 days, given a very specific set of circumstances where you've been in the hospital for 3 days and then they will release you to perhaps a skilled nursing facility. Medicare will pick up a portion as well as your supplemental insurance. But when you really think about long-term health insurance, think of it in terms of a medical condition that will last more than 100 days. And typically that medical condition renders you unable to care for yourself in your own home, for example, because you've perhaps had a stroke and at this point need help in dressing yourself or need help in preparing a meal. It tends to be custodial in nature and more than 100 days. I think everyone should consider first putting together a plan in the event you would need long-term care. And that could be done virtually at any age, because long-term care, although we often associate it with being older, it could happen at any time in our life. I think a good example is even remember Superman. Whose name escapes me right now, but here he's out riding a horse and the horse falters and he falls and he is paralyzed. Christopher Reeves, there's his name, and he's a real good example of someone who needed long-term care over a very long period of time that was really a very young man. So who needs long-term care? Maybe everybody needs to have a plan. Not everybody will need long-term care, but it needs to be something that is thought through, especially as we get older, because we do know that our health will change. I can tell you about that. Before I got into the business, my husband was responsible for long-term care planning with our clients, and I've been with him for the last 7 years now. So he actually was instrumental in helping my mom get a policy. And my mom was 70 years old, and it was time because all the church ladies had long-term care insurance. So she approached my husband, who at that time, like I say, was helping people planning for this particular need. And in her particular case, interestingly enough, she did have some health conditions. She did apply for the long-term care insurance, and she actually was declined initially. And we did some further research. Her medical records were incorrect. We got those corrected, and ultimately my mom was approved for long-term care. So she knew she was a widower. She knew that she wanted help in the home down the road, even though she had 4 children, one of which was not living in Grand Rapids, the other 3 having full-time jobs and raising their own families. She wanted the opportunity to remain as independent as possible in her own home, and had heard about the benefits of long-term care. And so my husband was instrumental. And as a quick side note here, we both commented, and I made it quite clear to him that if he was unable to help her with the long-term care insurance, that she probably would have to come live with us someday. And that sped up the whole process. Yes, it's been 10 years. My mom will be 80 years old next month, and about 2 years ago, it all started to kind of unravel in terms of her health. 2 years ago, she had back surgery, and although quite successful, again, just because of the aging process, other things came into play. So, over the course of time, she began to fail in terms of her ability to care for herself in the home. So I have worked with her over the course of the last year and a half, because with the policy, we first had to make sure she qualified. And in order to qualify, the insurance companies require that you're unable to perform 2 activities of daily living. And that's kind of an expression that's understood in the healthcare field. And those activities of daily living are the things that you and I take for granted every day. They're getting out of bed in the morning, being able to use the toilet, being able to feed oneself, be able to dress yourself, and so on. And in my mom's particular case, she's unable to dress herself without substantial assistance, and that's the real key there. And she's also unable to really get out of bed on her own speed, if you will. She does need help so that she does not fall. And as my mom has gotten older, that has been a bigger issue, is the whole issue of falling, and that fear of falling. So in her particular case, we have been working with the insurance company and qualifying her for her long-term care insurance, and she now is reaping the benefits of having paid premiums for the last 10 years. But she also has the benefit now of almost $200 a day in being able to have a home health care agency that's licensed in the state of Michigan here come into her home and help her. And the key is that the insurance company will be paying for those expenses instead of her having to pay for them out of her own pocketbook. So here, having paid thousands of dollars in premiums, she now will reap the benefits of far more than just a couple $1,000s a year in paying for her premium. Very much so. I am the oldest child. It's very common that the oldest child is one of the primary caregivers. And in this particular case, working full-time with my husband and running a business, it certainly has been very challenging in trying to meet all of her needs. And we continue to be an active part of her help and everyday assistance, but in having the policy, it really augments those times that we can't be there, because they will help with transportation, they will help in preparing a meal. So we work together, but again, it doesn't put my my job in jeopardy. And we also kind of feel the children, of which there's 3 others that are actively involved, that we're able to kind of distribute the caring needs, if you will, instead of one person being responsible, or one person, really kind of taking the hit as a result of it. So the insurance company has a lot of resources that we can avail ourselves to. So we've taken advantage of that. The best time to purchase long-term health insurance is when you don't need it, because the insurance company will not qualify you if you do have some pre-existing health conditions. So the best time to purchase it is when you're healthy and when you are younger, because the premiums are a function of your age and your health. So the younger you purchase your policy, the less expensive the premiums will be, and the more likely that you will qualify for the long-term health insurance. I recommend that people start thinking about it at age 50. There are a lot of companies, more than ever before, that are offering it as a group benefit. Some of it's paid for by the employer, or some of it is strictly voluntary. So I encourage people that are working to find out if their employer has such a plan that they could take advantage of. And if not, then to look at an individual plan, and that's what I help people with as an independent agent, representing a number of different companies. But back to your question, I would definitely say begin to start to think about the process in terms of how does a policy work, what are the triggers in terms of being able to take advantage of the benefits. When you're 50, start to talk to an insurance professional like myself so that you understand kind of the policy dynamics and how you qualify, and probably also it gives you a much better idea when you're younger what pays for long-term care and what does not. There's a lot of people that believe that your individual health insurance would pay for those 100 days or more that I talked about, and that's not true. Many people believe their disability policy that they have through their employer will pay for long-term. It does not. Disability is strictly income replacement. And people that are 65 and eligible for Medicare believe that Medicare will pay for it. So there's a lot of myths that are out there. So by starting younger, you get to ask lots of questions and you get a better understanding of the costs involved, because a lot of people in their 50s, they're still raising their families and they've got college expenses and mortgages perhaps that they're still paying down and that type of thing. But again, by buying younger, you also can save on the premiums. So I think there's real benefit in that. Well, I would say probably don't be so sure, and the reason for that is there are different underwriting guidelines that individual companies abide by. So in other words, what one company might consider as either a non-qualifier or a higher rated individual, another company might accept that individual. And you really never know unless you have submitted an application, answered all the medical questions, and had your doctor supply what's called the attending physician statement. So you may not think you qualify, but you might be surprised that you do. And the other thing I would point out to them is there is more than one type of long-term health policy. And there is a new breed of coverage that is referred to as a hybrid product. And the hybrid product is based on taking an annuity, for example, and putting a long-term care rider on it versus what's traditionally known as a traditional long-term care policy. The hybrids allow for more flexibility in underwriting, whereas the more traditional policies are a little bit more restrictive. The traditional policies are strictly a health insurance policy, whereas the hybrids are a type of insurance product, but they aren't a health insurance product. And I hope I didn't confuse anybody by that. But I just want you to know that there are some products that will definitely appeal to people that are in their 70s and even early 80s, because I have several clients who had actually set money aside for their long-term care. They knew they needed to do something down the road, and we were able to show them that they could actually take those monies, put them into a policy, and we could show them that the policy would double or triple with the long-term care rider benefit. So, for example, if you had $25,000 sitting in a CD at a bank and it was coming due and you didn't know what to do with it, you knew you had earmarked it for long-term health care planning needs down the road, you could actually take that $25,000, buy yourself a long-term care rider, and it could become $50,000 or $75,000 worth of benefits used in a long-term care situation. And people are finding that very, very attractive. Again, where could you take $25,000 and triple your return and use it in a long-term care scenario? So it, for some people, is a real good use of their money in that regard. And again, the underwriting tends to be not as tightly controlled, if you will. And with long-term care, medical kinds of questions, there clearly is a list of knockout kinds of conditions, and I would review those, in great detail before even submitting an application. A real good example is somebody that's been diagnosed already with Alzheimer's or a cognitive condition. That is a coverable condition in terms of long-term care, but only prior to the condition being diagnosed by a physician. So every once in a while I'll have somebody who knows of a loved one that has that and is looking for long-term care, and unfortunately at that point it's too late. But very clearly I help people with identifying with what those knockout kinds of conditions might be. In long-term, from an underwriter's perspective, they're looking at conditions that are going to render you unable or in a disabled kind of mode. This type of insurance is very much about living, but it's in the manner of which you would live. Again, meaning most of the care provided by this type of coverage is in the home. 80% of the care takes place in the home. It's because people can't do things on their own anymore without having someone help them. Whereas with life insurance, the underwriters are looking at the condition that will take your life. These underwriters are looking at those conditions that are going to put them in a disabled kind of mode. Well, I guess because we are living longer than ever before, it becomes, I think, even more difficult to predict how much money one might need. So when people tell me that they have lots of money and they're going to self-insure, I ask them, do you have any idea how long you might need that care? Because care today is very expensive. Again, a lot of care can take place in the home, and it may cost $18, $20, $25 an hour to have someone come in and help you. But if you needed 24/7 care, it could become very expensive when you do the math. In the event you couldn't be cared for in the home because you required more care and having someone help you in an assisted living condition or even a full nursing home scenario, the cost of care in a nursing home right now is about $65,000 or $70,000 a year. So back to, again, the person who says, well, I've got enough money, I can cover it. What if they were in the nursing home for 5 years? Do they have $350,000 or $400,000? We know that the cost of services for health care are continuing to rise, and that will continue. So again, in an effort to try to forecast, I may be 65 and I've retired, I don't need the care until I'm 90. Well, one, have you made money on your money? I mean, let's be real. Let's look at the stock market and some of the downside to that. But now if you don't need care until you're 90, one, how much money do you still have that you have available? And two, how much money might you need? Because if you were in a nursing home for, like I say, a 5-year period of time, it gets very, very expensive. And it also gets very expensive in the event you have a cognitive condition, because care is even more in the neighborhood of about $80,000 or $85,000 a year. And for most people, even wealthy people, that's a lot of money. And it certainly is a lot of money when you look at if you had an insurance policy that would virtually pay, how do I want to explain this? If you bought a policy and it cost you, I'll use my mom as a little bit of an example. She's spending about $3,500 a year now for her policy, and she's 80 years old. she has available to her over $200,000 worth of benefits. So again, I could show you that when you take your money and you buy yourself a long-term care policy, it's really pennies on the dollar. A couple $1,000s buys you a whole lot more than a couple $1,000s worth of long-term care coverage. So I sit down with people and I show them the illustration, and a lot of people look at it and they say, you know what, that really is a good use of my premium. And people can pay either on an annual basis. We've even got policies where you can pay for a period of 10 years, and then you have what's called a paid up policy. There's even policies that you can buy at, say, age 50, and you can pay to age 65 when a lot of people still are able to retire. So you've got a 15-year investment, because in many ways you're investing in your own health care future so that you've got the assurance that you've set money aside. And let me back up too and say that with those hybrid products, what I didn't point out is that with a hybrid product where you've taken, like we said, the $25,000 a year, or the $25,000 deposit that you've put into this policy, that money is always yours unless you spend it all on your care. So it really overcomes the objection that some people have when they buy a traditional policy, which is either use it or lose it. With a combination or a hybrid type of product, you take a lump sum of money, you put it into a policy. If you never use it, and I hope people don't, that they don't have to use their policies, but if they don't, they actually will have that money set aside for them in the form of either an annuity or a life insurance product. So it really is a win-win for them in that particular situation there. And a lot of people, they do want to leave a legacy for their children, and this is a way of being able to ensure that they have set a money aside that won't be eaten up, if you will, by the long-term care event. That they know they've got money set aside for that event, and they've got money set aside for their children or for their charities. It really is, again, it's about having a plan. You anticipate what that need might be. Yes, no one really knows whether you'll need long-term care or not, but statistics will certainly tell you that as you get older, and the statistic right now is if you reach the age of 65, there's a greater than 50% chance that at some point in time in your life you're going to need some kind of long-term care service. And what you don't know is whether that would be several weeks, several months, or several years. The average, they say, is about 2.7 years in terms of long-term care coverage at some point in time in your life. You know, women, when you look in the nursing home, there's a lot of women, much more than men. It certainly is even more of a women's issue in terms of care and coverage than it is of a man. You know, women live well into their 90s or even their hundreds. You look in the newspaper, and there's a lot of octogenarians, I think is the title. And the other thing is women take care of their husbands or the men too. And I often tell women, you know, if your husband isn't interested in buying it, you should buy it for yourself, because often what happens is you take care of the husband, you deplete a lot of your resources caring for him, and then what do you have? So by having a policy, you've also set money aside for yourself as well. Yep.
Good point. So, if anyone listening to this or watching this is interested in learning more about long-term health insurance, what do you suggest?
I would suggest that they give me a call, and what we'll do initially is talk a little bit about their health, because I stress the importance of being health qualified, and we can do that initially right over the phone. And then if it makes sense, what I do is spend personal one-on-one time, and we will talk about first what their plan is, and we'll ask questions like, where do you want to be cared for? Do you want to stay in Michigan, or do you have plans to live elsewhere? We'll talk about the kind of money that they have set aside for long-term care or not set aside. And then ultimately we will put together at no charge or cost several different quotes from different insurance companies. I help design the plan for the person, and that's based on a series of fact-finding kinds of questions. A lot of people say, I know I can't, or a lot of people will say, let me back up and say it this way. I am very much a proponent of some coverage is better than none. I put together options so that people can look at it and say, if I was to try to cover several years in the nursing home, this is what the premium would look like. It's not uncommon for people to say, I can't afford that. Could you show me something else? The beauty of long-term care planning and the insurance side is that you can customize the plan to best meet your needs as well as your financial budget as well. So it's very possible to work with someone and get them coverage for $50 or $100 a day, whereas other people say, I want to cover as much of it as I can, and we design the plan accordingly. It's done at no charge. We do a little health qualifying up front. We work on putting together a plan. We answer some questions, and then we fill out an application, and we go from there. No, there is no cost to them whatsoever. And sometimes what we find is if they are declined by one company, we will look at potentially another company. If it's acceptable to them, then we'll go ahead and fill out another application, and we'll resubmit it to another company. I guess my nugget in advice is this. Everybody needs a plan. And if you don't have a plan, somebody else is going to plan for you. So by giving some thought to it now, you can take greater control over the kinds of choices that you can make. The other thing, I guess my point would be, is the government is not going to take care of you. I mean, you are very much on your own when it comes to long-term care. And unless you have a plan for how you're going to pay for it, it could become very expensive. It could be devastating to families because it very much is about a family kind of event. The person that needs long-term care, they will be taken care of. I mean, we even have Medicaid. The problem with Medicaid is you can only be cared for in the nursing home, whereas with the other kinds of insurance that we've been talking about, you can be cared for at any place where care could be delivered. And again, most people want to be cared for in their own home. So by planning now, it gives you much greater control over your own destiny in terms of where you want to live, how you want to spend your money, the kind of people that you want to come into your home to actually help you. It allows you to remain independent for as long as possible. I have some clients who have pets, and they have bought the insurance knowing that they could care for the pet in their own home. They have a policy that would allow them to have someone come in and care for them, and they could care for their pets. So rather than having to go into the nursing home, again, they're saying, I want to stay in my own home for as long as possible. So being able to remain independent. And again, people don't want to be a burden to their children. They look at their busy lives. A lot of children don't live in town anymore. Years ago, kids lived, nearby their parents, and that was kind of one of the expectations was, we'll be there for our parents. Parents moved in, vice versa. That doesn't happen today. People lead very busy lives, and this way, by having a plan, by having a policy, it gives you more peace of mind. A lot of people have told me, I hope, Nance, I never use this, but I have peace of mind in knowing that if I do, I've made provisions for it. My family won't be, financially impacted. So I think it's a good thing.